So really what we want to know is how common is sudden cardiac arrest, and what are the causes of sudden cardiac arrest. So first I want to define prevalence, because I wasn't sure if everybody in the audience would know exactly what it meant. And really it's simply the ratio of the number of occurrences of a particular event to the total number of individuals that are at risk for that event. So in this case, it's the number of sudden cardiac arrests or deaths that occur over a certain time interval divided by the size of an age-adjusted population. So that sounds pretty simple. The problem is, how do we identify the cases? And the numerator is acquired through a number of methods, many of which are not perfectly accurate and not always going to give you, and are likely going to underestimate the absolute number of cardiac arrests or deaths. Most of the studies use death certificates, so right off the bat, we've eliminated any idea of how many survivors of sudden cardiac arrest there are. Insurance claims, public media reports, and the internet are also sources that others have used, but again, of course, some of these are going to be more publicized deaths than others, and the athletes tend to be the ones that get more publicity than the non-athletes. So what about the denominator? So when you're talking about sudden cardiac arrest in the general population, you can use census data, which should be pretty accurate. But for athletes, most of the studies are largely estimates. So we really have no idea how many athletes there are in this country because there isn't a mandatory reporting of any kind. And really, I think what this calls for is that we need a prospective, mandated national registry of sudden cardiac arrest and sudden cardiac death in the US and not just in athletes. So let's look at the numbers that we have. So the prevalence of sudden cardiac death in the young in the United States varies anywhere from 0.6 to 6.2 per 100,000. It depends on a lot of things, but it also depends primarily on who you call young. So it could be 30, 35, or 40 maybe the upper limit. And certainly if you include older adults in their 30s, then you're going to have a higher prevalence of sudden cardiac arrest. So the numbers that have been generated from the Center for Disease Control, this is a report from 1999, showed the prevalence of sudden death in ages 0 to 34 was 3 in 100,000. And that number has been validated across multiple states, including Michigan. And more recently, the Michigan Department of Community Health has put together a huge effort, a prospective registry starting in 1999, and they have data now up through 2009 on sudden cardiac death in young people ages 1 to 39. And the incidence of sudden cardiac death in that population is 5.5 per 100,000, which is higher than the CDC number, but keep in mind they're including 5 extra years on the upper end. And 50% of the sudden cardiac deaths that have occurred in this state in the last 10 years occurred in individuals who were between the ages of 35 and 39. So really the numbers are pretty consistent with the national data. So there is definitely a spectrum from 1 to 100,000 up to 14.5 per 100,000, depending on which age group you're looking at. So obviously the incidence of sudden cardiac death increases as we get older. And this is something that has been borne out in studies previous to this and subsequently non-athletes and athletes alike, in that there is definitely a large gender and racial discrepancy in rates of sudden cardiac death. White females are at the lowest risk, 2.4 per 100,000, whereas black males are at astoundingly high risk of 16.5 per 100,000. Nobody really understands why that is. Okay, so now I'm going to talk about the US athletes. So I'm going to shift back and forth between the general population and athletes because they've been studied separately. So this is now a US National Registry of Sudden Death in Athletes. Lisa showed data from this earlier. These are individuals under the age of 40, athletes participating in sanctioned sports of some kind, and this was a prospective registry from 1980 to 2006 headed by Barry Marin. And this was published in Circulation 2 years ago. So they had 1,866 total events, and of those 85 were sudden cardiac arrest survivors. About 50% of them were cardiovascular events. 80% of them occurred during exertion, and 66% of them, they were able to establish a postmortem diagnosis. So the incidence of sudden cardiac death that they estimated was 0.61 per 100,000 person years. Now that's quite a bit lower than what we've seen for the general population, but you got to keep in mind a couple things. So first of all, how did they get the numerator? Voluntary submission to a registry, public and media records, internet searches, and national databases. So you can see that there is probably, and almost certainly, an underreporting of cases of sudden cardiac death and cardiac arrest in this report. The denominator is an estimate and based on numbers of athletes competing from different sports organizations, so it's hard to know whether that number is accurate either. But it really is the best that we have, and it was a tremendous effort to put this together. As has been seen in other studies, the rates are highest in younger athletes. Notoriously, high school students are at higher risk than collegiate athletes. Males, non-whites, and certain high-intensity sports were also associated with a higher incidence of sudden cardiac death. So this was a really great study that was published earlier this year. And the reason it was so great was because it was a prospective registry and it was mandated. So this is a combined effort of the NCAA and Parent Heart Watch, who put together this registry of athletes participating in all NCAA sports, all 3 divisions, men and women, from 2004 to 2008. And altogether, they had almost 2 million athlete years as their denominator. And the incidence of sudden cardiac death, this is only sudden cardiac death, they did not include sudden cardiac arrest here, was 2.3 in 100,000. So that number is lower than the general population, but quite a bit higher than the other registry that I just showed you on the previous slide. So how did it break down as far as gender? As we've seen before, the ratio is about 3 to 1 men to women, which is similar to what's reported before, except previous studies have indicated it was even a higher rate, 8 or 9 to 1, men to women. And so this incidence of sudden cardiac death in women is actually much higher than has been reported in previous studies looking at athletes. So let's look at the racial disparity. It's tremendous, right? Black athletes, 5.7 versus 1.7 per 100,000, and we still don't have an explanation for why that is. And then when they broke it down into all 3 divisions, the highest rate of sudden cardiac death was in Division I athletes compared to Division II and III athletes. Then they further stratified the incidence of sudden cardiac death by sport. Not surprising, basketball was the one that came out on top, and that's been reproduced in multiple studies, 8.8 per 100,000 sudden cardiac deaths. Black male basketball players, 25 in 100,000. So really an alarming number, and again, not really a good explanation for why. Because the incidence of most of the causes of sudden death, as I'll show you, doesn't have any racial bias. So we don't know why more of them are dying suddenly. Swimming was surprising to be second. That's usually been one kind of lower on the list. So that was a little surprising to see. Lacrosse, 4.3, football, 2.6, and then cross country rounding out the top 5. So other than basketball, the mix was a little bit different than's been published previously. So that was interesting. So let's talk about what causes sudden death in our youth. And so I generally tend to break this down into heritable, in other words, familial genetic causes of sudden cardiac death, and then non-heritable causes of sudden cardiac death. And then if you just look at the genetic causes, I break it down into those with structural heart disease and those without structural heart disease. So when you're talking about structural heart disease, for the most part, you're talking about heart muscle diseases called cardiomyopathies. Many of you probably are familiar with this term, certainly after hearing Lisa talk. You know about hypertrophic cardiomyopathy, which is the most common inherited genetic condition, affects 1 in 500 people worldwide. This is a condition in which the heart muscle is abnormally thickened. It can lead to all sorts of complications, including sudden cardiac arrest due to lethal ventricular arrhythmias. Dilated cardiomyopathy is also an inherited condition that's characterized by dilation of the ventricular chamber, most often the left ventricle, and impaired squeezing function or contractility of the left ventricle. Oftentimes, these individuals are also predisposed to risk of ventricular arrhythmias. And finally, arrhythmogenic right ventricular cardiomyopathy, which Daryl mentioned is the #1 cause of sudden cardiac death in athletes in Italy, is a lesser cause in this country, but nevertheless an important cause of sudden cardiac death. It is a condition that is notoriously difficult to diagnose, even with echocardiography, because the abnormalities are frequently most prominent in the right ventricle, which is something that's not imaged very well with echo and often requires MRI to make a diagnosis. Also, the arrhythmias generally tend to be present out of proportion to the degree of structural heart disease. So you can actually diagnose somebody with ARVC with a completely normal MRI. So it's a very difficult diagnosis to make. So of the non-structural heart diseases, the major category are ion channelopathies. And long QT is probably the one you've heard of, if any of them. Long QT syndrome is characterized by a long QT interval, starting from the beginning of the QRS to the end of the T wave. And this has a prevalence about 1 in 2,000. to 1 in 2,500. Two other ion channelopathies I'll mention. CPVT is catecholaminergic polymorphic ventricular tachycardia. I didn't have room to write that on the slide. So it is triggered by exercise. Typically, resting EKG is completely normal. Keep that in mind when we're going to talk about screening. And then Brugada syndrome is another ion channelopathy that's rare and characterized by some subtle findings that maybe Daryl can pick out in V1 and V2 with some ST elevation. Many other causes of sudden cardiac death in the young. I've just listed a few here. Coronary arterial disease, coronary anomalies. Daryl mentioned sometimes the arteries come off in strange locations and they might course between two big blood vessels and get squeezed at an inappropriate time. Atherosclerosis is certainly something we need to consider even in young people, particularly with the epidemic of obesity and other risk factors for early cardiovascular disease. The most common infectious cause of sudden cardiac death is myocarditis. So this is typically a viral infection of the heart muscle, sometimes preceded by obvious upper respiratory tract infectious symptoms, but not always. And this can also lead to lethal arrhythmias as a result of the acute inflammation in the heart muscle. Congenital abnormalities, aortic and vascular disease. Marfan syndrome is the genetic condition that many of you may be familiar with, is associated with aortic dissection and rupture and aneurysm. Commotio cordis is a relatively frequent cause of sudden cardiac death. It's not necessarily considered cardiac in that there's no intrinsic cardiovascular disease, but a blunt trauma to the chest at just the wrong time can actually interrupt the normal electrical rhythm and set off a potentially lethal arrhythmia. Drugs. We don't really have a good handle on to what extent, if any of these drugs are contributing or triggering sudden cardiac events, but certainly there's enough cause for worry, I think, with steroid use, illicit drug use, stimulants, psychotropics, and asthma medication. Okay, so I'm going to show you a little bit of data, and really the best data, honestly, looking at the causes of sudden cardiac death of the young comes from our own state. And the Michigan Department of Community Health has put together a tremendous surveillance project detailing causes of sudden cardiac death by reviewing death certificates in all individuals who have died suddenly between the ages of 1 and 39 who deemed to have a cardiovascular cause of death. You might be surprised. You keep hearing HCM is the most common cause of sudden cardiac death in the young. It is in athletes, but not in the general population. Atherosclerosis, far and away, 40% of all sudden deaths, ages 1 to 39. Most of those, again, are in the 30s. If you look under the age of 30, it's not quite so prominent, but it's still a significant proportion. Dilated cardiomyopathy, about 14%. HCM makes up just under 10%, and then you can see the other diagnoses there. So let's contrast that with the causes of sudden death in young U.S. athletes. So this is data from Barry Marin's study that I showed you previously and that you saw from Lisa. This is something that probably looks more familiar to you. This is the most common cause of sudden cardiac death in U.S. athletes, being hypertrophic cardiomyopathy or possible hypertrophic cardiomyopathy. And you can see a list of many of the other diseases I've already spoke about, each representing less than 10% of the total. So let me sum up and leave you with a few closing thoughts. So prevalence of young sudden cardiac death in the general U.S. population is about 3 in 100,000. A lot of variation due to differences in definitions, age and type of the study population, how we're ascertaining our cases, inconsistencies in classification of cause of death on death certificates, to name a few. The prevalence of young sudden cardiac death in U.S. athletes is somewhere between 0.6 and 4 per 100,000. The real answer is probably somewhere in the middle of that, and probably right around or maybe a little bit below that of the general population. But remember that there are certain subsets that have come up time and again as being at higher risk: males, black athletes, basketball players, and some other high-intensity sports. The most prevalent causes of sudden cardiac death are vastly different, whether we're talking about athletes or the general population, so you really need to keep that in mind. Another important thing to recognize is that we are deriving the etiology of sudden death largely from death certificates. And I think Lisa already mentioned this. Death certificates are notoriously inaccurate in defining causes of death. Even if you have the autopsy report to review, having looked at a lot of autopsy reports recently, they're often very ambiguous. They're not done in a comprehensive enough fashion that you can really definitively define a cause of death for many of these individuals. So we really need to do a better job in including postmortem genetic testing. I think will be a very important step in helping us to define the cause of sudden death in these athletes and identifying family members at risk. So everything I've said has very important implications for cardiovascular screening that Mark Russell's going to talk to you about. So Darrell already brought this up. Who should we be screening? it seems like we're biased if we say we're just going to screen athletes. The prevalence of sudden cardiac death in U.S. athletes is about the same it is in the general population. We need to be looking at all of our children and young adults and everybody. So use of sudden cardiac arrest form, like Lisa proposed, I think is absolutely the way to go. How should we be screening? And Daryl's already brought up the controversies around ECG, but we need to find a sensitive and specific way to be screening children and young adults, athletes and non-athletes, that will have the greatest likelihood of detecting the most prevalent causes of sudden death. And so this is my last slide. I think throughout our discussions tonight, I would encourage you to remember that exercise benefits every single individual, child, adolescent, young adult, old adult. And participation in physical education and organized athletics not only models healthy lifestyle habits that those children are going to use throughout their lifetime to ward off all these horrible things that are an absolute epidemic in this country, obesity, diabetes, hypertension, cardiac and vascular disease, but it builds camaraderie, it builds leadership and team skills that they're going to use for the rest of their life. So I also wanted an excuse to show my alma mater racing for the national championship in cross country, and to show pictures of my two kids doing what they love doing. So thank you very much for your attention. I want to acknowledge everybody from the planning committee who's been absolutely tremendous in putting this together. Dr. David Pinsky, sorry, I almost put the highlighter on you, the laser pointer on you, sitting over there. He is my chief and has been provided tremendous support for this program. Mark Russell, my co-director of the program, Tom Draper, and everybody else. I couldn't have possibly put everybody's name on here and made it legible. All of the members of the Hypertrophic Cardiomyopathy represented up here, and the Michigan Department of Community Health, Deb Duquette, Janice, and Beth, who not only provided us data, but with whom we have an ongoing collaboration to really look into this problem further, and funding from the Center for Disease Control. So thank you very much for your attention.